Today we are going to learn about lung meridian. The couple organ of lung meridian is large intestine. That is also written as Li. A number of points on lung meridian are 11, total 11. The first one is lu1, which is mu front point. Z cleft point is lu6. Yuan source point is lu9. Leo connecting point is lu7. Jingwell point is lu11. Mother point is lu9. Zone point is lu5. And horary point is lu8. And we will be covering lu1, lu5, lu6, lu7, lu9 and lu11. Let's look at the points where they are placed on our body. lu1 just next to collarbone, and rest you can see on the arm. lu5, lu6, lu7, lu9 and lu11. So we are just going to discuss. Just have a look where they are. You should have this impression in your mind. Then it will become very easy for you to remember. The first one is lu1, which is mu front point. You know, mu front point, they are basically present on the front side of the body. So it's shown, it's next to the collarbone, lu1. It is the crossing point of the lung and spleen meridian basically. It is 6 tune from the midline of the chest. Indication: cough, asthma, wheezing, shoulder and back pain, chest pain. In case of excess condition, you will have chest pain. So you can make out this pain. This will be a painful point. When you press, you will feel there is some pain. So you press the area to check. Massage this area. It's a very good point for dispersal of chi. It regularizes stomach chi. So if you press this point, it can help in regularizing the energy. lu5, sun point. You can check the location. It's there. It's next to the elbow. Located on the cubital crease on the radial side of the tendon of the muscle biceps. That is the positioning of sun point, lu5. It's also he-she point. Here the chi of the meridian collects and goes deep into the body. These points treat rebellious chi and diarrhea basically. Indications are cough, asthma, sore throat, pain in the elbow and arm, then urine retention. It's the best point to clear the residual heat. If there's heat in the body which is not going out, so this point helps in that. lu6 point, you can see in the figure, it is located 5 tune distal to the point lu5 on the line joining lu5 to lu9. So there's all these points are on the same line, lu5 to lu9, and this is the point which is located 5 tune distal to the point lu5. Then it is a Z cleft point. You know, Z cleft point means where you have accumulation point. You can call it energy is accumulated there, and it's a Z cleft point for lung meridian. It's used during acute emergency. So it's also used for sore throat or people having nosebleed, pain in the forearm. Then you have febrile diseases without sweating. It stops bleeding, clears heat. In case of choking, we should use lu6. Again about Z cleft point. It is the site where the chi of the meridian is deeply converged. We have already seen. We have checked in the previous slide that Z cleft points are the points where the chi of the meridian is deeply converged. Z cleft point is the site where the Z or the chi of the meridian is deeply converged. Chi and blood are stored deeply at these particular points. Basically, these are the points where chi and blood are deeply stored. If there appears abnormal reaction at Z cleft point, if you find some reaction happening at this point, it shows that the pathogens have entered the deeper parts of Zhangfu organs, that the pathogens have entered the deeper parts of the Zhangfu organs. Thus, they are used for acute painful symptoms, inflammation, which are pertaining to meridians and Zhangfu organs. They also Z clef points of yin meridians have homeostatic function also. lu7. It is one chun above the transverse crease of the wrist. You can see in that picture. So we have lu7 over here. It is a Leo connecting point of the lung meridian. Confluent point for Ren meridian also. Command point of head and neck. Indications: head and neck problems, migraine problem, urogenital system problem, weakness of the thumb and index finger. It's a master point for which pairs with kidney 6. lu7 is the main point for releasing the exterior of wind cold and wind heat. The respective yin and yang meridians are internally, externally related to Leo connecting points. Leo connecting points of one meridian can communicate with two meridians. They treat diseases of the collaterals and can be used to treat chronic diseases, especially chronic diseases of the Zhangfu organs. Clinically, Leo connecting points are often combined with yuan source points in the treatment of diseases. So Leo connecting points can be combined with yuan source points when you have to treat the diseases. So lu9, you can see in the figure, it is present on the radial end of the transverse crease of the wrist where the radial artery pulsates. So when you check the pulse and there is the radial artery which pulsates, you find there this point. Yuan source point of the lung meridian. It is the yuan source point of the lung meridian. Indications are cough with phlegm, asthma and weakness, wrist pain or hiccups. This point is used to treat varicose pain problem also. It descends lung chi, descend करता है ची को, नीचे लाता है, and influences the pulse. Coming to lu11, which you can see in the figure, which is just next to your nail. It is located on the lateral aspect of the thumb at the junction of the lines intersecting from the radial border of the fingernail and the base of the fingernail. Indications: it shows sore throat, tonsillitis, cough, asthma, fever, loss of consciousness. It can be treated in case of these kinds of diseases. It is a Jingwell point of the lu meridian.